I grew up in Newport, Rhode Island. I grew up in a really small, tight, but pretty poor town. There was the rich part of Newport, the poor town. But we kind of had a rich family life, rich neighborhood, and so I had lots of privileges growing up. We didn't have any money, but we had lots of privileges. When I was training at Mass General, I was an internal medicine resident, and my interest was oncology. I wanted to do specialty care, and I, in truth, knew virtually nothing about homelessness. And it was during my residency from 82 to 85 that we started to see what I would call the upswing in this current sort of episode of homelessness across the country.
I'll be right back. It'll take me 5 seconds.
And when I was finishing my residency, the city of Boston had been one of a number of cities around the country to get grants to try to reach out and take care of this newly growing group of people who are using the emergency room all the time. The homeless people themselves were looking for a full-time doctor.
These are shorts for later, but there's a whole, you should put that on now. That's really nice.
I thought, hey, I can go work in a shelter clinic, and do this for a year, be my year of giving back. But what I didn't know at the time was there was virtually nothing. There really was no health care available for folks in the shelters and out on the streets.
I got to check on that. You need that Mass Ioneer appointment. Right. I will do it.
The core mission at Boston Healthcare for the Homeless program is to assure or to provide the highest quality health care to all people experiencing homelessness in Boston or who have experienced homelessness. And we want to be sure we do that in the most equitable way possible.
People who are experiencing homelessness in our society are some of the most marginalized and stigmatized people on earth. But they're almost invisible to the rest of society. It's absolutely shameful. I first met Jim when we were both in training at Mass General Hospital, now well over 30 years ago. He was unforgettable immediately because he was so humble and cheerful and modest.
Jim is special out here. He knows almost everybody, has great relationships with people. People look to him for comfort. He treats everybody as a human being, not as a patient.
Jim is a saint. He created a street team approach that's multidisciplinary. He has revolutionized care for vulnerable people in a very fundamental and profound way.
I don't know if we've changed the overall arc of homelessness, but I think in the individual lives we've done a lot to get to know people, work on easing some of their daily suffering, and just giving them a place where they know that they are welcomed and at home. And I think I've come to cherish that as, for now, the most important part of what we do.
I think Jim will always be remembered as one of the extraordinary healers of our time. He's a historic figure. And if I can just stress, he has done it one day at a time without ever promoting himself. He is a man of fundamental humility and decency and compassion. So he inspires all of us to be the best we can possibly be.
The word that comes to mind is his humility. He doesn't make a big deal about himself. He just wants to do the work.
I still feel just as passionate as ever about the complexity of caring for someone who's stuck in this position. It requires the best of each of us to do that.